We've had huge advances in breast cancer treatment in the last couple of decades or so. We're trying to move towards a position where a patient comes in with a breast cancer and we know exactly, based on what is driving that cancer, what drug to give that patient. Our overall goal is what's called precision medicine. It's not a one-size-fits-all. It's a specific drug for a specific patient's cancer. And we've really made a lot of headway in that direction, which is resulting in improved outcomes for our patients with breast cancer. I'm Dr. Ruth O'Regan, a professor of medicine in the Division of Hematology and Oncology at UR Medicine. Historically, we've used a lot of chemotherapy in treating breast and other cancers. And the problem with chemotherapy is that it's relatively effective in killing cancer cells, but it also kills a lot of normal cells in the body. That's why you lose your hair, for example. I think one of the hardest things for patients with breast cancer is when they get chemotherapy, they lose their hair. And what's been available for several years now is what are called cold caps, where you basically freeze the scalp while patients are getting chemotherapy. And this means that the chemotherapy doesn't get to their scalp and their hair as much as it would have without the cold cap. So this allows women to preserve their hair. So it's a huge advance, because if a patient loses their hair, everybody knows they've got cancer. So just recently at Pluto, we actually were able to acquire 2 machines that allow us to treat 2 patients at the same time. So we're very excited about this, because we really believe that this is going to allow, the majority of women to actually keep their hair while they're getting chemotherapy. The Wilmot Cancer Institute really is a fantastic place to work. We really have very well-renowned oncologists, surgeons, radiation oncologists, and I think that's one of the reasons to come here, as well as the fact that we do have a lot of research going on, particularly clinical research. So we would have potentially clinical trials available here that wouldn't be available elsewhere.